I'm Patty Mouton. I serve as Vice President for Outreach and Advocacy for Alzheimer's Orange County, and I've been here almost 15 years. Memory care is a specialized type of assisted living care. It requires a special waiver from community care licensing in order to ensure that the staff in the board and care home or assisted living is very familiar with the different diseases of dementia and understands how it may impact the individuals in their care. Determining whether or not your loved one requires memory care is a decision that you make with the person's doctor and with the senior care professionals that you're planning to place your loved one with. A diagnosis of dementia typically means that an individual requires a little higher level of care, a little more acute observation, a little more attention to their specific needs, perhaps with dressing, with using the toilet, with assistance with eating. So you want to be sure that if your loved one has a diagnosis of dementia, that their safety and their well-being is all part of the plan of care when you're getting ready to place them in a board and care home. Irvine Cottages serves the families and people who require placement in an assisted living board and care type of environment. People who have medical frailty, people who have a cognitive disorder like Alzheimer's type dementia, people who need assistance with their regular activities of daily living and shouldn't be living on their own. In memory care, you want to be sure that the loved one is getting lots of good stimulation that is appropriate to their level of functionality. Music that's going to move them, make them want to dance and participate. Music they can sing along to. At Irvine Cottages, there's music therapy 3 to 4 times a week. You want to be sure that they have stimulating activities so that people are engaged and they're challenged and they're really enjoying themselves. You want physical exercise to the extent that the person can participate safely. You want outings. They want to be able to go places, parties that celebrate the different seasons and holidays throughout the year. A really wonderful board and care home will have all of these components that become such an important part of the individual person's plan of care. Irvine Cottages was founded in 1996 by Dr. Jacqueline DuPont, a gerontologist who really understood that the needs of older adults had to be learned, had to be built upon, and then care had to be structured that would be unique to the needs of people as they age. Irvine Cottages is really an entity all to itself in board and care homes in Orange County. There's a nurse on staff 24/7. They have an executive team of professionals that have worked together for many years. And because they know each other so well, because everybody is engaged in this compassionate mission of care, it really helps to make sure that the care provided each individual resident is not only of the highest quality, but of the greatest heart.